Tyler Long shares a common bond with his mom, Michelle, that reaches far beyond the normal mother and child relationship. This is his miracle story.
Tyler loves to play, loves to joke around, loves to make people laugh.
My favorite things are math and sometimes my math journal, and I like to play at home with my sister.
He's like any typical normal little child. You can't tell that anything's wrong with him. I knew that I had the Fabry's disease, and I was afraid that he might, so I got him tested when he was 3 months old.
Both Tyler and his mother have the genetic trait that leads to the diagnosis of Fabry's disease.
What Fabry's is an enzyme missing from his body that keeps the fatty tissue away from the kidney, the heart, and the lungs. So his is actually getting cluttered up with the fatty tissue, which can result in kidney failure, heart failure. And like I said about the teens, they told me he might start developing the symptoms. Even
though Tyler's doing great now, we know he has this disease that's going to happen. And so one of the magic cures of medicine in the recent years, they've been able to identify the enzyme or the chemical that is the problem. And now we are able to give Tyler that enzyme, and hopefully by giving him the enzyme through a transfusion, we can keep that toxic waste product from accumulating in his arteries.
I was going for treatment in Odessa, and we've been doing that for about a year, and then the drive was just getting too much.
Tyler's mom asked me if there was any way we could do those treatments here. And so, again, I called the pediatric nurses here and called our case manager and said, hey, here's something we'd like to use our treatment center for. Is there anything we can do to see about doing that? Chief executive officer of the hospital said, hey, this is important, let's go for it.
It's just so much better. And like I said, the nurses were great in Odessa, but these nurses here, Tyler has them wrapped around his little finger, and he loves it.
The nurses are really nice.
Tyler has a very outgoing personality. The first time we met him, he was very shy, didn't want to talk to us, but by the second time he came, he came in bouncing, talking, and he's just very, very outgoing.
Well, he's a little tigger. He comes bouncing in, ready to play.
Dr. Weiner made it possible for us to be able to do the treatments together.
Mom comes to the pediatric floor too. They do it together, and both of them get their intravenous treatment and spend far less time on the road, and so it's a much greater time that they have to spend together and enjoy each other, and so it's been a great experience.
Through funding from the Children's Miracle Network, doctors and nurses at Shannon get the training they need in order to treat patients with uncommon diseases like Tyler and Michelle.
When we first learned that we were going to have Tyler and Michelle as patients, we didn't really know anything about their problem. And the company that makes the product that we infused to them came and offered us a workshop. So all of our nurses went, the pediatricians went, and we all learned about Fabry's disease and how to administer this medication for these people.
Nurses went, got all that training, they're approved for using the medication, so the company that makes the enzyme gave their stamp of approval that our nurses could do it, so now they are officially Fabry disease preventing nurses.
We had to do some extra work to learn about their disease. We had to attend an in-service, but nobody here minded. It's anything that we can do to help the kids.
We've been really blessed that Shannon Hospital initially said, yes, this is something we agree that needs to be done, and we recognize it's going to take some initial investment, but they've supported us. Then we've been luckily picked after that by the Children's Miracle Network that has really increased our abilities to provide that kind of care, to send nurses. It pays for nurses to get the training, such as for Tyler for his treatment of Fabry disease. It pays for those trips. It pays for a clinic that's just for outpatient chemotherapy for children. That's the kind of thing that the Children's Miracles Network's helped us in treating kids that here in town that otherwise would have had to go a long way.
I'm thankful for that.
Please support the Children's Miracle Network and help a miracle kid like me.